Hello everyone and welcome to this webinar. My name is Marije van Dalen and I'm a research psychologist at the Erasmus MC Sophia Children's Hospital. In this webinar I will tell you more about distress and parenting stress in parents of children with a cleft lip with or without a cleft palate. This talk is based on an article that has just been published in the Cleft Palate and Craniofacial Journal. If you wish to read the article, I have included a link in the description below this video. So, parents of children with a cleft lip with or without cleft palate can face many different challenges. For instance, when a child with a cleft lip is born, parents may be confronted with other reactions of shock. Other worries may also be present, for instance, worries about how do you inform your family about the condition that your child has. And when a child grows up, different challenges may occur. Parents may worry about how best to inform the teacher and the class about the child's condition, or parents may worry that the child might be teased or bullied because of their appearance. And lastly, parents may also be confronted with hospital visits and medical procedures. These hospital visits may go along with insecurities. So for instance, parents may be insecure about what procedures might follow and what the future medical trajectory for their child would be. And also the actual procedures themselves can also be very stressful for parents and children. So parents of children with a cleft lip with or without cleft palate may actually experience quite some different challenges. Due to these challenges, one could think that parents of children with a cleft lip may experience distress and parenting stress. So parenting stress can be seen as different processes that lead to psychological and physiological reactions. So that means that stress arouses reactions in the body as well as in the mind. These processes arise when parents try to adapt to the demands of parenthood. On the short term, the stress can often be beneficial, but on the long term, the stress might be harmful. Parenting distress is defined as the extent to which a parent perceives stress in his or her role as a parent. Parents with high levels of distress often experience symptoms of depression or anxiety. And in research, we mostly study symptoms of depression and anxiety when we want to know if parents experience distress. To attempt to explain adaptations of parents with a child with a chronic medical condition, Wallander and colleagues proposed a model. So first they thought there were different risk factors involved. These could be things that have to do with the medical condition itself, such as the visibility of the condition. The amount of strain the condition puts on the physical care parents have to provide was also seen as a risk factor. And lastly, psychosocial factors that cause stress in parents could also be involved. These factors could be related to the child, such as behavior problems, but they can also be related to the parents themselves. Major life events such as divorce, losing a job, or the death of a loved one can also be seen as psychosocial stressors. These risk factors can be influenced by resistance or protective factors. Wallander and colleagues proposed 3 different types of resistance factors. So the first is interpersonal factors, then there are also social ecological factors, and there are factors to do with the stress processing. Interpersonal factors are factors that are present within the parent themselves. So for instance, a high self-esteem in the parent can act as an interpersonal resistance factor. Social ecological factors are factors that are present within the parent's environment. So factors such as a very supportive family environment and good social support can act as resistance factors. And lastly, stress processing refers to how a person deals with stress. Cognitive appraisal refers to the label someone puts in a stressful situation or thought. So when faced with a stressful situation, one parent may think that it's just temporarily and that he can deal with it. One other person may think that they won't be able to deal with the situation properly and get overwhelmed. Coping strategies, on the other hand, refer to the way a parent deals with a stressful situation. So when someone experiences stress, some people use humor and try to seek support from others. Other people have less helpful coping strategies and may, for instance, deny the situation, blame themselves, or use food or alcohol to suppress their stress levels. All these risk and resistance factors may eventually influence the parental adaptation. Adaptation is how well parents are adapted to their surroundings. Parents that have adapted well are expected to have high levels of self-esteem and experience less distress and parenting stress than parents that have not adapted well. So in our study, we sought to answer whether parents of children with a cleft lip experience more distress and parenting stress, and whether the model as proposed by Wallander and his colleagues was appropriate for this group of parents. We tested only a part of the model, so as you can see here, the parts that we did not test have been grayed out. We wanted to know if risk factors such as the visibility of the cleft lip, additional difficulties related to the cleft lip, and child behavior problems would influence the parental adaptation. So to answer this question, 173 mothers and 136 fathers of children with a cleft lip with or without a cleft palate participated. These parents reported on a total of 181 children with a mean age of 7.2 years old. The age of these children ranged between 2 and 12 years old. Because we wanted to test the influence of the visibility of the cleft lip, parents of children with an isolated cleft lip did not participate in this study. Parents of children with a cleft lip with or without a cleft palate could participate. In the remainder of this presentation, I will refer to this group of children as children with a cleft lip. What we did to assess the risk factors and distress and parenting stress, each parent completed several questionnaires. Parents completed questionnaires on parenting stress, depression, anxiety, and hostility. Parents also completed questionnaires on emotional and behavioral problems in their child, and a questionnaire to assess whether the child experienced additional difficulties related to the cleft, such as speech or feeding problems. So first we wanted to know whether parents experienced more distress and stress than parents of children without a cleft lip. To do this, we compared the questionnaires to a norm group. For parenting stress, parents were compared to other parents, and for anxiety, depression, and hostility, parents were compared to people of the same age and gender. And what we found was that both mothers and fathers of children with a cleft lip experienced less stress than parents in the norm group. Parents of children with a cleft lip also experienced less anxiety than their peers. Both effects were quite large. And then we looked at depression and hostility. Mothers and fathers did not differ from the norm group concerning depression. For hostility, we found the same results. Parents of a child with a cleft lip did not differ from parents in the norm group on the amount of hostility they experienced. So, overall, parents experienced less parenting stress and anxiety, but not less depression or hostility when compared to the norm group. Next, we looked at factors that could influence distress and parenting stress in parents of children with a cleft lip. We looked at the type of cleft, so a cleft lip or a cleft lip and a palate, the age and gender of parents, the age and gender of their child, child behavior problems, the visibility of the cleft lip, and other problems related to the cleft lip and or palate. Our results show that distress and parenting stress were mainly influenced by child behavior problems and other problems related to the condition. Parents of children with more behavioral problems experience more stress and more symptoms of depression. Parents of children with more additional problems experience more stress and symptoms of depression and hostility. We also found that parents of older children experience more anxiety than parents of younger children. For all our outcome measures, it did not matter what type of cleft the child had. So it didn't matter if the child had a cleft lip or a cleft lip and a cleft palate. Furthermore, it didn't matter if the cleft was very visible or not. We also could not find an effect for age of the parents, gender of the parents, or the child's gender. So this means that mothers didn't report more stress or distress than fathers, nor did the amount of stress in parents differ on whether the child was a boy or a girl. And lastly, older parents did not differ from younger parents in the amount of stress and distress they experienced. So overall, we found that parents of a child with a cleft lip experience less stress and anxiety than other parents. The amount of stress and distress parents experience is mostly related to child behavioral problems and other issues related to the cleft. So despite the challenges that these parents might go through, they experience less distress and stress than other parents. We have not tested why this is the case, but we proposed two phenomena that could explain this finding. The first is post-traumatic growth. After experiencing something traumatic or distressing, people actually grow and learn from it. So post-traumatic growth is different from the resilience. In resilience, the idea is that people bounce back and return to their old level of functioning. And in post-traumatic growth, people bounce back but come out stronger than before the traumatic or distressing event. The second phenomenon is a response shift. And when a response shift occurs, people shift their internal standards and values. Someone might see stressful situations in a new light. Let's say that a parent has a flat car tire. This person might have thought this was a very stressful situation, but after a response shift, the same parent may think, I have overcome so much that flat tire is something I can definitely cope with. So in turn, this parent probably also experiences less stress in this situation. Thank you for listening to this video and this webinar for the Earbrain Cranio. If you have any questions, feel free to contact me, the Earbrain Cranio, or take a look on our website. Thank you, bye!